one of the things you said at the beginning was that health economics is part of how people make decisions about their care.
Mhm.
So it would seem that if somebody has a chronic illness, like you're saying, schizophrenia,
Mhm.
and there's like an acute phase, which is they're in the hospital.
Yeah.
Then there's a like early chronic phase, right? Where they're learning to live with it. And then
Mhm.
there's the recovery phase, which is they're mostly living with it, meaning they've come to some kind of equilibrium and they've found a place that they can function.
Mhm.
So are the health economic considerations different for those different like stages?
I think you ask a very good question.
Okay.
Okay, so I want to bring in some alarming issues I just discovered.
Okay.
So first of all, I found that we always talking about how to smartly utilize the system or how we improve our healthcare system to make sure everyone get like equal chance to be treated. But the overtreatment and undertreatment could coexist within the same healthcare system and even within the same system, same payment system. When we're talking about undertreatment, overtreatment, the undertreatment part is for the person who have been diagnosed with mental illness at some point during 1 year. So at the population level, about 30% of our population who will be diagnosed with mental illness, but only 17% of them will get treatment.
1-7 or 7-0?
17.
17.
Yeah.
Wow.
Yeah, absolutely.
That's pathetic.
Only 17% of them get treatment. So in any healthcare sector, and the other 7% will get their own treatment from like self-help group or like a peer support group, such as maybe you have heard it's Alcoholics Anonymous, such type of support group.
Right.
So the number is very small. Even we're talking about schizophrenia, about 57% of schizophrenia patients actually get treatment. But on the other part, some people have been over-treated in our healthcare system. So, those individuals with no diagnosed mental health conditions, they also getting treatment for like mental health and addiction or substance use care. So they are making around like 8 visits per year, as much as the people who actually have been diagnosed. So the people who have been diagnosed with mental health like issue or condition, they made 9 visits per year. So this is a very awkward situation. Undertreatment, overtreatment could coexist in the system. The other part is, it looks like as I mentioned earlier, our government actually pays a lot compared to the private insurance sector. Medicaid pays somehow larger than in the mental health and substance use setting. But the other part of reality is it provides such mental health and substance use insurance coverage. They provide some coverage for lower range of spending, but leaves the household or the family and even the patient unprotected against the more expensive treatment. I know you will ask me to talk on this. I found some literature, and I am really surprised to find the Medicare Part A, they have covers in patient care for the patients who need mental health treatment in either like a general hospital or psychiatric hospital, only for 190 days of hospital service in your lifetime.
90 days in your lifetime.
Yeah, 190 days.
Oh.
It's no It's not beyond 200 days or even 1 year in your lifetime. It's not like 1 year. So if like you are getting enrolled in Medicare, if you get enrolled in Medicare, that means the patients need to pay like 400 copay per day, starting from the 60 days. And if you go beyond this 190 days, probably you will pay 800 per day for lifetime reserve days in the year. Wow. So this is how much the patient actually pay. So back to the question, yes, there are different stage, acute stage, chronic stage. It brings to my attention like our patients are not sufficiently covered even during the acute care stage.